Okay, I hope now the issues are resolved as of now, and we'll start with the part. So we'll be discussing about the general anatomy now. See, the basic definition of general anatomy, it says that it is the science that deals with the structure of the human body. It deals with the structure of the human body. Remember that what do you mean by the term ana? See, ana means basically to see a part, and tomy basically means to cut. To cut. Wherever we are using tomy word in the entire medicine, it means to cut, like hysterectomy, salpingectomy. So tomy basically means to cut, and ana means to see, to visualize a particular part of the body. And that is why it is the science that is dealing with the structure of the human body. You know, we have various organs in our body like liver, heart. So it is basically the general morphological structure. Apart from that, guys, you should also know that anatomy, it is also called as dissection in Latin. It is also called as dissection in Latin. It is also called as dissection in Latin. So that was the basic definition regarding anatomy. So now we will start with the branches of anatomy. Okay, we have multiple branches of anatomy, and nowadays like questions are not coming from a particular branch, like radiological anatomy questions are also there. Okay, so we will study the definitions of each of the branches of anatomy one by one. The very first one, that is the gross, cadaveric or macroscopic anatomy. See, whenever we talk about the word cadaver, cadaver means basically dead body. Cadaver means basically a dead body. And remember, this type of anatomy is basically studied. It is studied on dead bodies. It is studied on dead bodies, okay, with naked eye. Okay, with naked eye. In my classes also, in my online classes that I took on Zoom, I actually showed you the pictures of heart, lungs, okay, so like of a dead body, okay. So basically the cadaveric or macroscopic anatomy means to study the dead bodies, okay, the parts or the organs of the dead bodies with the naked eye. Coming on to the next branch of anatomy, that is the microscopic anatomy, also known as the histological anatomy. So you all guys know that cell is the basic unit of life. Okay, cell is the basic unit of life. Okay, cells combine and they form tissues. Okay, cells combine and they form tissues. Okay, tissues combine and they form organs. Organs combine and together they form the organ system of the body, and ultimately the body or the skeletal framework is ready. So cell is the basic structural unit of life. Okay, cell is the basic structural unit of life, and you should know that the cell, to study the structure of the cell, basically it is another branch of anatomy that is called as microscopic or histological anatomy. Why microscopic? Because the structures such as the cells and the tissues are studied with the help of microscope. So it is the study of structures with help of microscope. With help of microscope. So it is the study of structures such as the cells. We are talking at the molecular level, at the cellular level right now. So the cell structures, the tissue structures are basically studied with the aid or with the help of a microscope, and that is, it comes under another branch of anatomy, that is the microscopic or histological anatomy, guys. That is the microscopic or histological anatomy. So Coming on to the next one, that is the developmental or embryological anatomy. Developmental or embryological anatomy, it is the third branch of the anatomy. Okay, so what does it means? That it is the study of prenatal, it is the study of prenatal and postnatal developments in an individual. So everyone knows that ki prenatal, what do you mean by the term prenatal? Prenatal basically means before birth, and pronatal, postnatal basically means after birth. So basically it is the study of uh, so it is the study of the prenatal, means before birth, the developmental, the changes that occur in an organism, and postnatal, after birth, what are the structures that are developing. Okay, so ultimately all the formation from embryo to fetus to complete like cycle of a human being, it is studied under developmental or embryological anatomy. Okay, prenatal before birth and postnatal after birth. Coming on to the next, that is the living anatomy. And remember that living anatomy is basically studied on living beings. It is studied on living beings. It is studied on living beings by inspection, palpation, percussion, auscultation, and many more methods. So basically palpation means you will actually give force. For example, like if suppose the liver is enlarged in size, okay, or if there is abdominal pain, you will touch, you will push the abdomen, and will like you will try to assess the clinical signs, okay, of that particular patient. Percussion to basically just the tapping of the fingers on particular structures such as heart. Okay, okay, so to know the borders of the heart, whether the borders of the heart, if it is increased, it means it is cardiomegaly. So it is generally basically studied on living organism, basically the patients which come to your clinics, okay, with severe complaints, and after that you are actually accessing the clinical condition of the patient by performing these particular methods. Apart from that, auscultation, you all know that putting a stethoscope in your ear and actually are trying to auscultate the patient, okay, the heart sounds, the lungs, okay. So ultimately the living anatomy is that branch of anatomy which is basically studied on the living beings, and that too by different methods. Apart from that, guys, coming on to the next branch of anatomy, that is the fifth one, that is the neuroanatomy. And guys, you very well know that the neuroanatomy basically involves the brain and the spinal cord. And remember that the neuroanatomy is basically the study of structures. It is the study of structures of the nervous tissue, okay, the nervous tissue and the organs, that are the brain and the spinal cord. These are the parts of the central nervous system. Why? Because they are aligned along the center of the body. Okay, they are aligned along the center of the body, and neuroanatomy itself is a branch of anatomy where you are more focused to learn the structures of brain, spinal cord, their functions. Okay, so moving ahead with the other three branches of the anatomy, the clinical anatomy, that is the sixth one, and you all know that basically it is also called as the applied anatomy. It is also called as the applied anatomy. applied anatomy, and it deals with the application. It deals with the application of of anatomical knowledge to medical and surgical practice, to medical and surgical practice. See, clinical anatomy nowadays, if you will ask me ki what, like in any exam, whether it is next or PG exam or FMG exam, more questions are basically based on clinical anatomy nowadays. Okay, that's why I will put a dollar sign over here. And students, please remember that it is basically that it is dealing with the application of your anatomical knowledge. Okay, to medical and surgical practice, to for doing a particular surgery for like any intestinal obstruction or liver surgeries, transplant surgeries. It is the first requirement that you should know the basic anatomy of that particular organ, and yeah, to apply that particular knowledge in performing the surgery or for your medical or medicine practice as well. So apart from that, coming on to the next, that is the surface or the topographic anatomy. Remember, it is basically the study of deeper parts of the body. It is study of deeper parts of the body in relation to skin surface. In relation to skin surface. Okay, which is actually helpful in clinical practice. Okay, which is helpful in clinical practice. Helpful in clinical practice. So surface or topographic anatomy, studying the deeper parts of the body, okay, in reference to the skin surface. Whenever we dissect, okay, we first make a cut or incision on the skin surface, and then we move on to the internal organs of the body, and that is actually helpful in the clinical practice as well. Apart from that, coming on to the last branch of anatomy, that is the radiographic anatomy, guys. And you know that it is basically the study of structures of the body. Study of structures of the body using radiographic techniques. Using radiographic techniques. Using radiographic techniques. So basically it is the study of structures of the body using radiographic techniques. Nowadays dyes are basically there, okay. We are using it in CT scan also, okay. So that is all about the different branches of the anatomy, and I hope guys you all are along with me and you all have written all this. Yeah, Tarunjan, endoscopic and one of the procedures, yeah, in living anatomy that we are performing as well. So I just wrote it can be like, okay. So I just give me a thumbs up, guys, that all of you have noted all this. Yeah, yes, absolutely. We have the skin layer, the muscles and the bones. Yeah, that is comparatively okay, Amanat. So yeah, just give me a thumbs up, guys, that everyone has written this. Yeah, then we'll move on to the subdivisions of anatomy now, and we'll try to classify anatomy into two parts. So I'm waiting for your answers, guys. Like everyone is along with me, I suppose. Okay. Siddhi, Pratham, good guys. Hoor, Arvind, Ronak, very good guys. So we are over with right now the basic classification of anatomy. Yeah, Arsh, very good. Prikshit, Pavan, Gaurav, very good guys. I mean, I'm so happy that you all are writing along with me, and that's very good. Yeah, very good guys. Good. So now moving ahead Yeah, moving ahead with the classification. So remember that it is further divided into regional anatomy, regional anatomy, and Ankit, Yash, okay, good. And yeah, it is the systemic anatomy, guys. It is the systemic anatomy, guys. Now, what is the difference between the regional and the systemic anatomy? So, remember, guys, that regional anatomy, basically the body is studied in parts. Over here, the body is studied in parts, and systemic anatomy, basically the whole body is actually integrated and studied in system. So here the body is studied in system. Nishant, Naresh, Renuka, Deen Dayal, Sanvi, very good, guys. Like, you all are participating, that's very good to hear. So here in the systemic anatomy, guys, the body is studied in system. The body is studied in system. Now coming on to the regional anatomy, that is your first year, like what all topics that you all learn in first year, that is the head and neck, head and neck, the thorax part, the thorax part. Apart from that, the upper limb, the upper limb. The next, that is the lower limb, pelvic region, and the brain along with the abdomen. So the regional anatomy is basically the one which the body is basically studied in parts. First we'll discuss head and neck, thorax, then upper limb, lower limb, pelvic region, brain and abdomen. So the body over here will be studied in different parts, guys. Okay. Apart from that, the systemic anatomy, guys, you all know that we have various systems in our body. Okay, whether it could be the skeletal system, the muscular system of the body, the muscular system. Apart from that, we have the nervous system, guys, the nervous system. Integumentary system, that is dealing with the skin, the layers of the skin. And you all know that. Can anyone tell me which is the largest organ of the body? I'm waiting for your answers, guys. Can anyone tell me which is the largest organ of the body? So yes, apart from that, guys, the cardiovascular system, the respiratory system, and the digestive. Pratham, very good, Naresh, Anshay, Prikshit, Nishikant, very good, Ankit, Laris, very good. You all guys are correct. Earlier, when I was like taking classes online in different universities, students often used to say it as liver. No, guys, it is the skin which is the largest organ of the body, and this is the basic concept that you should know. Yeah. So the digestive system, we have endocrine system, thyroid glands. Apart from that, your favorite reproductive system, that is like studied under systemic anatomy. Okay, so these are all the systems like where the body is together integrated and studied. Okay, and regional is we have divided the body into parts, and yeah, we have divided the bodies into parts. And then Now guys, I want your attention. Now we will start, this was just the general one. Now the conceptual part starts, okay? The anatomical position, guys. So now we'll start with the anatomical position, guys. The basic thing that you should know, what is the normal anatomical position? What is the normal anatomical position? Yeah, integumentary system में skin आ जाता है. Yeah, रेणुका. Yeah, okay, okay. So starting with the anatomical position. So what is the normal anatomical position? See, in the normal anatomical position, write down guys, the normal anatomical position, the person has to stand upright. The person has to stand upright. Stand upright. He has to look straight, okay? Look straight or looking straight. Apart from that, guys, the person should stand upright. He should look straight. And the next thing, that is the upper limb. Upper limb. And upper limb should be in a hanging position. Upper limb should be in a hanging position. You can very well appreciate that this is the upper limb, guys, from the shoulder region till the hand, okay? So it is the upper limb, and upper limb is basically in a hanging position, okay? A little deviated from the lateral surface of the body, okay? A little deviated from the lateral surface of the body. So the upper limb should be in a hanging position, okay? And I know you know the bones of the upper limb as well. So here, yeah, it is the humerus bone. It is the humerus. The thumb side, it will be the radius, okay? And on the little finger side, it will be the ulnar bone, okay? And the bones of the hand, carpals, metacarpals and phalanges. So okay, palm facing forward. And apart from that, guys, one more thing, that the lower limb, the lower limb should be parallel to the toes, okay? The lower limb should be parallel to the toes. So this is the normal anatomical position, guys. And remember one very important thing, that all the bones, when you describe, they are described in the normal anatomical position, okay? They are described in the normal anatomical position. So yeah, this is the palmar surface, you can see, and it is facing forwards, okay? So that is the importance of the normal anatomical position. And if suppose in the viva the examiner asks you to describe the humerus bone, now humerus are basically, it can be of right side also, it can be of left side also. And when you pick the right humerus, you should hold the right humerus in the right hand. You cannot explain right humerus by holding it in left hand. This is not correct. So all the bones that you are explaining to the examiner, or it should be firstly in a normal anatomical position, and ultimately if it is of right side, it should be holded with respect to that particular hand only, okay? If it is right humerus, right clavicle, right ulna, right radius, it should be holded in that particular hand, and then you have to explain it to the examiner. Otherwise examiner will you will explain the whole bone, and ultimately you will like land up giving you 0. Why? Because you didn't hold the bone right in the respective hand. So that is the importance, guys, you should know. So these are the practical aspects, and apart from that, you have, like you saw, the normal points regarding the normal anatomical position. So these are the 5 points that you have to keep in mind, okay? So moving ahead, guys, moving ahead with, yeah, so I hope everyone has written this. So just give me a thumbs up that all the students are participating as of now. and they all have written about the normal anatomical position, and they all are clear with the normal anatomical position concept. Yeah, so I'm waiting for your answers. Naresh, okay, good Naresh. Pratham, very good guys. Nishikant, Laris, very good guys. I mean, all are participating, that's very good. Anshay, Arsh, Ankit, Arvind, Amanat, very good. Sanvi, very good. Guys, don't skip the class. Your response will actually encourage me to take further classes in future. Yeah, it's not about just listening, you have to participate as well. Yeah, Salik, Ronak, Deen Dayal, very good, very good. Prikshit Hoor, very good. Sanvi, very good. I mean, comments are flashing off right now in front of me. So, yeah, I'll just move ahead now. So, let's start with the basic concept, guys. What is right or left in. Okay, right or left is decided according to the doctor or the patient. My question is, and it's a very basic question, guys. Right or left is decided according to the doctor or the patient. So that is, you guys have to tell me right now. Yes, yes. So I'm waiting. Yeah. Gaurav, Yash, Ronak, very good. Siddhi, very good. Good. Yeah. Yes, Pratham, that was the point I wanted to like make clear in your mind. It is the patient whose right or left actually matters. Okay, so you know that if it is a normal anatomical position, this part will be the right part and this part will be the left part. Yes, everyone is right. Salik, it cannot be like according to the doctor, because the patient, if he will come to you and he will say that he's having left abdominal pain, so left abdominal will be like according to the patient it will be here, but when you will see or encounter the patient, you will land up in the right area. So that's what the point I wanted to discuss. So it is the patient whose right or left is actually important. So the patient, we are not considered as observers. Okay, so the patient is the one which he's coming to you with the complaints, and right or left is basically decided to the patient's complaints. Okay, apart from that, guys, like, okay, now starting with the very first concept, that is the anterior, the terms in the gross anatomy. Okay, so the terms in the gross anatomy, that is the anterior one, the very first one, that is the anterior. And you can easily notice that anterior is basically the surface which is in front, the surface which is in front in the normal anatomical position. Again, guys, I am telling you that everything it is basically according to the normal anatomical position, according to the normal anatomical position. And yeah, it is the anterior, so anterior surface, so basically it means that it is towards the front, it is towards the front. Okay, or the front part of the body, you can very well appreciate in the given image in the normal anatomical position. And if I say the palmar surface, the palmar surface, it is basically anterior. Okay, it is basically anterior. Okay, apart from that, guys, coming on to, okay, so coming on to the next, that is the posterior surface, guys. So you can see in the normal anatomical position, the posterior one is the back side of the body. Okay, it is the back side of the body. You can very well appreciate it is the back side of the body. So it is actually the posterior one, it is towards the back. It is towards the back. It is towards the back. Okay, Apart from that, guys, try to remember the next term, that is the superior and inferior. Superior and inferior, and you guys can very well appreciate superior basically means towards the head region. Superior basically means towards the head region, and yeah, it means towards the head, and the inferior means towards the feet, towards the feet. So the inferior means towards the feet. Let us understand this with the help of an example, guys. So you all know that the heart over here, it will be the heart. So, and over here it will be the intestine, the small intestine. Okay, so ultimately, yeah, just down to that it will be the small intestine, and you can see that the heart is superior to small intestine, or if simply I can say the small intestine is inferior to heart. The small intestine is inferior to heart. It is inferior to heart. So yeah, superior and inferior basically means that towards the head it will be the superior part or the upper part of the body. The inferior basically towards the feet, and with the help of an example I'm just trying to distinguish that taking two parts in the body and how they are located, okay, superiorly or inferiorly. Apart from that, guys, coming on to the next one, that is the concept of medial and lateral. Medial and lateral, that is very very important again. Now coming on to the concept, that is the medial and the lateral one. The medial and the lateral one. Now guys, you all know that, for example, just see the vertical axis that is passing just like between the midline of the body. Okay, it is the vertical axis. So medial basically means it is towards the median plane. It is towards the median plane. It is towards the median plane or to the midline of the body. More precisely, it is towards the midline of the body. Apart from that, if you are talking about the lateral one, yeah, the lateral is basically away from the midline. Away from the midline, or simply if we can say that towards the side of the body. Towards the side of the body. Towards the side of the body. Now guys, I just want to ask you that in the normal anatomical position, we have the little finger and we have the thumb. Which one is medial and which one is lateral? I'm waiting for your answers in the chat box, guys. According to the normal anatomical position, which one will be the medial one and which one will be the lateral one? The little finger and the thumb. So yeah. Little finger will be medial. Very good, Prakshit. Thumb is lateral. Very good, very good. Yeah. Yeah, little is the medial one. Why it is the medial one, guys? You can easily appreciate from the image that in the normal anatomical position, the little finger is basically coming closer to the midline as compared to the thumb, which is away from the midline. Okay, which is away from the midline as compared to the little finger. So whenever we are comparing two things right over here, you can easily see that the little finger, it is like medial, and the thumb, it is the lateral one. The thumb, it is the lateral one. Now I want you guys to fill the option. The heart lies dash to the lungs. The heart lies dash to the lungs. So I'm waiting for your answers, guys. What, like, out of medial and lateral, what is the answer over here, guys? So you should know which is the medial one. Yeah. Okay, I'm waiting, guys. So the heart lies dash to the lungs. No, you have only two option, Prakshit. Over here right now it is medial or lateral. It is medial or lateral. I'm not getting the answers. Yeah. Nishikant, medial. Very good. Prakshit, medial. Medial. Heart is medial to the lungs. You all know that over here we have the lungs, and in between basically the heart is located. And ultimately, as compared to the lungs, the heart is coming very much closer to the midline of the body. That's why the heart lies medial as compared to the lungs. Yes, yes, yes. अंकित बच्चे लेटरल नहीं होगा. आप खुद देखिए लंग्स के बीच में जो मीडियास्टेनल स्पेस होता है, एंड एग्जैक्ट लोकेशन इज द कार्डियक नॉच ऑफ द हार्ट. ओके, मीडियास्टेनम जो स्पेस होता है वहां पर हार्ट लोकेटेड होता है, एंड इट इज अ नोच विच इज एक्चुअली लाइक बाय द लंग्स. So ultimately the heart is lying closer to the midline of the body, and that's why the heart lies medial as compared to the lungs. Okay, so I hope the concept is clear. So yeah, coming on to two more things over here. I wanted to discuss something regarding proximal or distal. Proximal and distal. Now guys, try to remember the fact that proximal को याद कैसे करें सर. Proximal का मतलब होता है पास, okay, and distal starts from D. Remember it as दूर, okay, that is very far. So proximal and distals are basically, these are the terms, they are applied on a single limb. That is the key point that you have to remember, that this is applied on a single limb. Okay, I cannot take one point over here and one point on the upper limb and one point on the lower limb. It is not like that. Proximal and distals are only the terms, the anatomical terms which are applied on a single limb. They are applied on a single limb, and ultimately proximal basically means which is very much closer to the midline of the body. Okay, closer to the midline of the body, or I can say simply the axial body. So write down, it is closer to the axial body. The axial body, the portion which I have shaded on the screen, this is the axial body. This is the axial body, or appendicular. You all know that the upper limbs and the lower limbs, okay, these are the appendicular parts. So distal is basically, it is further away from the axial body. It is further away from the axial body. It is further away from the axial body. So let us understand this with the help of an example. If suppose I say, you can see there is the foot and this is the thigh. So if I simply ask that the thigh is dash to foot, the thigh is dash to foot, what will be your answers, guys? I'm waiting for your answers now. So yes, the thigh is dash to foot. What is your answers, guys? Out of proximal and distal, you have to fill one option. Yeah, Prakshit, yeah, Pratham, very good, guys. I mean, what about rest? Others are there or not? Kindly answer, guys. Yeah, Nishikant. Okay, like I gave you only two options, Nishikant, as of now, whether proximal or distal. You have to fill according to that. I'm not giving you superior and inferior right now in the options. So yeah, thigh is proximal as compared to the foot. Okay, so it is proximal as compared to the foot part. Proximal. Okay, so the thigh is proximal to the foot. Okay. Okay. Now if suppose I take two surfaces or 2 points, suppose one point over here, that is A, and one point over here, that is B. So that two parts basically I'm taking of the humerus bone. Okay, humerus bone. One will be the A, one will be the B part, and both of them are referred as the epiphysis of the humerus bone. Both of them are referred as the epiphysis of the humerus bone. Can anyone tell me which one will be the proximal epiphysis and which one will be the distal epiphysis? Which one will be the proximal epiphysis and which one will be the distal epiphysis? Yeah, I wanted to know that in the humerus bone we have two epiphyses, right? And out of that, just based on the normal anatomical position, you guys should be able to differentiate between the proximal. Yeah, A is proximal. Very good, Pratham. Yeah, Anshay, very good. Sanvi, very good. Yes, good. A is the proximal one. Why? Because it is lying very closer to the midline or closer to the axial body. Okay, compared to the B part, that is the distal epiphysis. Basically the 2 points are taken on the same limb or the same bone. Okay, it is applied on a single limb, okay, or a single bone can be there. Yeah, very good, Nishikant, Fatima, Ankit. What about rest, guys? Rohitash, yeah, Arsh, Hariom, very good, guys. Yeah, B is the distal one. Just based on the concept that proximal will be lying close to the midline of the body as compared to the distal part, which is lying a little far from the midline of the body or to the axial part of the body. Okay, two more concepts that I wanted to discuss with you over here, that is the superficial one and the deep one. The superficial one and the deep one. So remember, superficial basically means it is closer to the surface of the body, closer to the surface of the body, and the deep one basically it means that it is further away from the surface of the body. It is further away from the surface of the body. Now again, if I put a question over here and you will try to answer this question, the sternum is dash to lungs, and you have two options, superficial or deep. So what will be the answer, guys? I'm waiting for your answers in the chat box. Yeah, sternum is superficial. Very good, Pratham. Prikshit, very good. Sternum is superficial as compared to Anshay, very good. Yeah, very good. Nishikant, Laris, Arsh, very good, guys. Yeah, it is superficial to the lungs. It is superficial to the lungs. Yes, it is superficial. Yeah, Arsil, very good, very good. Guys, please kindly participate in answering the questions. I'm keeping a view that all of you are like doing great. Yes. Okay. Sternum is superficial to the lungs. Sternum is also called as the breastbone. Okay. Apart from that, you all know that it is very superficial as compared to the lungs. Lungs are much deeper as compared to the sternums. So yes, that is done. Apart from that, guys, okay. Before that, I just wanted to discuss one more part, that is regarding, yeah, Ronak, Deen Dayal, very good, guys. I wanted to discuss two surfaces over here. Okay, the palmar surface that already I have discussed. So write down, just mention in your note. The palmar surface is basically the anterior surface of the hand. This is the hand part and this is the palmar surface. It is the anterior surface of the hand. Anterior surface of the hand. Whereas we come to the plantar surface. Okay, plantar surface. So basically it is the inferior surface of the foot. Inferior surface of the foot. It is the inferior surface of the foot. Yeah, Arvind, Sanvi, Nidhi, Ajay, very good. I actually want everyone to participate. Yeah. Apart from that, try to mention two more terms, that is the ipsilateral and contralateral that we are actually using in anatomy. Ipsilateral basically means it refers to same side of the body, whereas contralateral means it refers to opposite side of the body. It refers to opposite side of the body. So we have discussed about the ipsilateral, contralateral, anterior, posterior, superior, inferior, medial, lateral, plantar and palmar surfaces as of now. Also proximal and distal, superficial and deep. I hope all the anatomical terms are clear, and just to you guys should remember that these anatomical terms are only applied in normal anatomical position. These are only applied in normal anatomical position, and just give me a thumbs up that you all are done with the basic terms in anatomy, and so that I can move further. The terms I can start with the terms in embryology as well. So just give me a thumbs up that all have completely learned all this right now. Yeah, all the terms, the concepts are clear in your mind. Yeah, very good. Hari Om, Anshay, Pratham, Prakshit, Naveen, Yash, very good. Yeah, very good, Yash. Crystal clear concepts are there. Yeah. Guys, do participate. Yeah, everyone. Very good. Nishikant, very good, guys. It is like for you people only. If you will participate and you will learn daily, then I will have the courage to come again live on YouTube and share my knowledge with you guys. Okay, so yeah, coming on to the next part, that is the terms in embryology. So write down the first one, that is the ventral basically means towards the belly. Ventral basically means towards the belly, or it is like the anterior part. It is like the anterior part. Okay. So ventral is basically compared to as the anterior part. You can see that this is the structure of an embryo, of a developing embryo, and the ventral is basically that part which is the belly part, and more or less we use like it is comparable to the anterior word. Apart from that, guys, try to remember the fact that another term that we are using in embryology, it is the dorsal one. It is the dorsal one. Prakshit, that are anatomical movements. I have only discussed the anatomical terms right now. I will be discussing anatomical movements after the terms in embryology and planes. Okay, so wait, we will discuss it today. Don't worry. Okay, we'll discuss it today. Yeah, palmar surface, basically it is the anterior surface of the hand, that is this part. Okay, the anterior surface of the hand, that is also known as the palmar surface. Okay, the palm one. Okay. So, Nidhi, I hope it's clear. Coming on to the dorsal part now. Yeah, it is basically towards the back. And remember, it is like posterior that we already discussed in the normal anatomical position, the posterior one. Yeah. Yeah. Okay. So apart from that, guys, two more terms that you have to learn, that is the cranial part, also called as the cephalic part, also known as the rostral part of the embryo. It is basically towards the head. And remember that it is like superior. Apart from that, guys, the last term that you have to remember in the embryology, that is the caudal part. And remember, it is towards the tail. Okay, so over here it is the caudal part, guys. That is towards the tail. Okay, and ultimately it is like the inferior part. Guys. So the terms in embryology, you should be well aware of ventral. Ventral basically means simple, आगे वाला हिस्सा जो है, the belly part. Okay. Apart from that, the dorsal, that is the back surface of the body. Cranial, sir wala part. Above, like superior. Caudal, inferior, that is towards the tail. I hope the terms in embryology also are clear as of now. Yeah, the terms in embryology also are clear as of now. The ventral, sometimes we are using it in normal anatomical position also, like for adult people also. Okay, so not a cause. So moving further ahead, the anatomical planes, guys. So we'll now start with the anatomical planes. Yeah, in the anatomical plane, the very first one, that is the sagittal or the longitudinal plane, or I would perfectly say it as the mid-sagittal plane. Yeah, Pratham, Prakshit, Sanvi, very good, guys. Mid-sagittal plane. See, it is a sagittal plane which is actually running from superior to inferior in a vertical direction, guys. Okay, in a vertical direction, it is running from superior to inferior, and remember, it is a plane which is dividing the body. Okay, it divides the body parts into right and left. And remember, guys, that the right and left part of the body externally will be equal. Okay, it is dividing the body parts into right portion and the left portion. Okay, a plane that is running from superior to inferior through the midline of the body. Okay, it is passing through the midline of the body. It passes through the midline of the body, okay, and that is why the name it is midline of the body, and that is why the name mid sagittal plane, okay, where the left and the right portions of the body will be equal, where the left and the right portions of the body will be equal. Apart from that, guys, coming on to the next, that is the frontal or the coronal plane. Remember that in this particular plane, it divides the body parts, it divides the body parts into anterior or posterior portions. So it is passing, okay, in such a manner that the anterior part, that is in the normal anatomical position, and the posterior parts are separated, okay, that is a coronal plane or the frontal plane, okay. So ultimately the anterior and the posterior portions are divided, the body is divided into these two portions, and that is too by the frontal or the coronal plane. Apart from that, guys, coming on to the next, that is the transverse plane, and remember, the plane is parallel to the ground, you can see this plane, it is basically parallel to the ground, okay. So the plane is parallel to the ground, and ultimately it is dividing, and it divides the body into up and down portions, that is superior and inferior, So it is a plane which is parallel to the ground, okay, also known as the transverse plane, and it is dividing the body into up and down portion, that is the superior part of the body and the inferior part of the body. So it is a transverse plane, guys. So all the three planes, I hope it is clear to everyone. Now I wanted to ask you a question. If suppose this is a body, okay, in a normal anatomical position, now my question to you guys is, if suppose a line is passing like this, what is the name of this particular plane? If suppose a line is passing vertically, it is not crossing from the midline. It is crossing a little far away from the midline. So what is the name of this particular plane? I have not mentioned over here. So I want the answers, guys. I just want to see if you are able to guess it right or not. Yeah. Can anyone let me know the name of this particular plane? Yeah. No one is answering as of. Okay. Longitudinal plane to nahi. No. Okay. Okay, guys. See, it has a special name. It is also a sagittal plane, but remember, it is a parasagittal plane. Which is actually not crossing from the midline. It is parallel to the mid-sagittal plane. Guys. It is parallel to the mid-sagittal plane. Both of are the sagittal planes. Why sagittal? Because it is crossing the body vertically from superior to the inferior part. But one which is going through the midline of the body, it is the mid-sagittal plane, and the one which is going a little away from the midline, okay, whether it is right or left, it is called as the parasagittal plane, just parallel to the mid sagittal plane. Okay, just parallel to the mid sagittal plane. So that was, yeah, vertical plane, sagittal planes all are like, okay, but you have to be very much clear in your mind कि parasagittal क्या है sir और mid sagittal क्या होगा. Okay, yeah, very good guys. So apart from that guys, the last topic and very important topic for today, that is the anatomical movements that you all have to be perfect with, because you will learn muscles in future of the upper limb, lower limb and all over the body. So these anatomical movements basically you should know in regards to the action of the muscles as well. So basically the anatomical movements, they are used to describe the actions of the muscles, the actions of the muscles, the actions of the muscles. And now guys, the very first anatomical movement that you should know, that is the flexion and extension. Flexion and extension. See, both these movements, they occur in the sagittal plane. Okay, so the movements basically they occur in the sagittal plane. The movement, it occurs in the sagittal plane. And apart from that, what is the basic difference between both of them? Both these movements basically they refer to increasing or decreasing the angle between the two body parts. The angle between the two body parts. The angle between the two body parts. Now how sir? How to explain this? Now let us take the first case, that is of the first anatomical movement, that is the flexion. See, flexion basically means it refers to a movement. It refers to a movement that decreases the angle between two body parts. Two body parts. Now, if suppose, let us understand this with the help of an example. Suppose if I talk about the flexion or at elbow joint, you know that this is the elbow joint over here, and if I just want to tell you that the anatomical movement, that is the flexion at elbow, it will be basically decreasing the angle. Okay, it is decreasing the angle between ulna and humerus. Between ulna and humerus. You know that in the anterior compartment of the arm, okay, the arm region, so here is the humerus bone. Okay, here is the humerus bone, and you all know that we have the ulna bone in the medial aspect. Okay, it is just closer to the little finger. We have the ulna bone in the forearm, and humerus in the arm. So okay, just let's first understand कि सर arm क्या है और forearm क्या होता है. तो देखो, arm is something which is basically located above. It will be the shoulder joint. Above it will be the shoulder joint, and below it will be the elbow joint. Below it will be the elbow joint, and in the arm region basically a bone is located, that is called as the humerus. Apart from that guys, the elbow joint to the wrist joint, basically two bones are there. Okay, on the medial side it is the ulna, and on the lateral side it is the radius bone. So whenever the flexion will take place, basically the angle between the humerus and the ulna will decrease. Now suppose this is the angle, and ultimately if the flexion will take place, the angle will actually try to decrease. Okay, so that is the flexion in case of the elbow joint. Apart from that, if you will ask me ki, sir, what is flexion in the lower limb? So flexion in the knee joint, it will be basically the ankle. You can see the ankle region will actually try to move closer. Okay, the ankle moves closer to the buttock region. Okay, so that is a flexion, basically the angle between in the thigh region we have the femur bone, and in the leg we have the tibia. Okay, so angle between the tibia and the femur gets smaller. Angle between the tibia and the femur gets smaller. So flexion in the knee joint, basically the angle moves closer to the buttock. Okay, closer to the buttock. And remember, the angle between the femur and tibia gets smaller, and the angle between femur and tibia, it gets smaller. So ultimately you can also see that flexion in the upper limb is simply like the forward movement of a particular limb, where the angle between the two body parts are decreasing, and flexion in the lower limb is basically the reduction of the angle. Now here in the thigh region we have the femur, in the leg we have the tibia, and the angle between these two are getting smaller. Okay, so ultimately that is flexion in the lower limb as well. I hope the flexion is clear to everyone now. Ki what do you mean by the flexion in the upper limb and flexion in the lower limb, by the help of like the examples related to elbow joint and the knee joint, guys. So just give me a thumbs up. Yeah. Yes, I'm waiting for your answers, guys. Yeah. Just explained, Prakshit. Yeah. And it's okay. Okay, Pratham, very good. Ronak, very good. And yeah, Naresh, very good. So flexion is something which is actually aiming to decrease the angle between the two body parts. Okay, it is decreasing the angle between the two body parts. Now we will understand about the extension one, and write down in the extension. Basically, it refers, put the heading as extension and write down. It basically refers to a movement that increases the angle between the two body parts. The angle between two body parts. Now you can easily see that if suppose we are talking about the elbow joint over here. Okay, so if the extension is happening at elbow joint, and remember the extension at the elbow is increasing the angle between the ulna and the humerus, Apart from that, guys, you know that this is the humerus bone, and on the medial side we have the ulna, and on the lateral side we have the radius. So ultimately, if extension is taking place, so what will happen? The angle between the humerus and the ulna will automatically increase. Extension be going more away from the body. You can see over here in the picture. Okay, and extension at the knee joint, basically it will try to replace the lower limb in its same anatomical position. So remember that extension of the knee basically it straightens the lower limb, the lower limb. Extension of the knee, basically it will actually replace the lower limb in its normal anatomical position. Okay, so extension and flexion is done. Coming on to a beautiful picture over here, and guys, I want the answer, which one is extension and which one is flexion, A or B? Waiting for your answers, guys. Yes, waiting for your answers, guys. Which one is extension, which one is flexion? If you're clear with the concepts, kindly answer my particular question that is displayed on the screen, guys. Which one is extension, which one is flexion? A is flexion, Anshay, very good. Very good. A is flexion, B is extension, guys. You all know that flexion, basically the forward movement of the part of the head is actually coming down, okay? Yeah, and extension basically to extend the neck, okay? The angle is basically getting decreased over here. The angle is getting enlarged in extension. So A is basically the flexion. A is basically the flexion and the B is basically the extension. So what maximum is angle? Yeah, maximum it will be 180 degree because extension cannot be beyond that. You cannot like take your hand much like, if you are talking about the complete upper limb, it can be from 0 to 90 degree and it can be over abduction also. It can be more than 90 degree also. So yeah, flexion and extension. Very good, guys. Ronak, Pavan, Arsh. Very good, very good, very good, guys. Apart from that, guys, moving on to the next one, that is abduction and adduction. Okay, so abduction, देखो, adduction का मतलब क्या होता है? Adduction basically the addition of a particular limb towards the body. Okay, so remember, okay, first we'll talk about abduction. Okay, abduction is basically a movement away from the midline, away from the midline. Okay, and adduction basically means movement towards the midline, movement towards the midline of the body, towards the midline of the body. So adduction means movement towards the midline of the body and abduction means movement away from the midline. Add का मतलब ही क्या होता है? किसी particular चीज को add करना body की तरफ. To add a particular part of the limb, okay, towards the body, towards the midline, okay. So ultimately add का मतलब जमा करना होता है ना. So ultimately it's just by the name adduction. If suppose it's in a normal position like this, it will just add it to the lateral side of your body. It is adduction. Abduction is taking away that particular limb from the body. Okay, so yeah, apart from that, guys, try to remember the fact in hands also. Okay, and like fingers and toes, basically the midline. So write down in fingers and toes. Yeah, midline used is not the midline of the body. It is not the midline of the body. And remember, the midline over here, it is basically the middle finger that we are using. apart from all the uses of the middle finger, the over here it is actually the midline that is regarded as key point, okay, that is actually helping in abduction and adduction. So adduction basically means coming closer to the midline, and adduction means basically going away from the midline. So guys, can anyone tell me which one is the abduction and which one is the adduction, A or B? I'm waiting for your answers, guys. Taking the middle finger as the midline of the body in hands and in toes. Basically, if I just want to differentiate between abduction and adduction, so yeah, what is the abduction and adduction in the given image that is displayed on the screen? A is abduction. Very good. A adduction नहीं हो सकता राजे. Prakshit, A couldn't be adduction because it is going away from the midline. देखो ना, it is going away from the center. Okay, so it will be abduction, taking something away. Okay, A is abduction. Yes, guys, A is abduction, and B is adduction. Adduction सबको जोड़ दिया ना. Add का मतलब ही क्या होता है? जमा करना, सबको एक साथ मिला दिया. Coming closer to the midline, it is the adduction. It is the adduction. Very good, guys. I mean, all of you are participating. That's nice. Yes, Laris, very good. Very good. हाँ, typing mistake वो हो जाता है कभी. Okay, okay, okay. This is a very okay. Coming on to the next term, that is the medial and the lateral rotation. Okay. And remember, these two things are basically describing the movement of the limbs around their long axis. So they describe the movement of the limbs, movements of the limbs around their long axis, around their long axis. So we have two types, the medial rotation, and medial rotation is sometimes called as the internal rotation, guys. It is sometimes called as the internal rotation, guys. So medial rotation, basically it is the rotational movement. It is the rotational movement towards the midline of the body, towards the midline. Okay, and lateral rotation, it is basically the movement away from the midline. Okay, so lateral rotation, sometimes also called as the external rotation, sometimes also called as the external rotation. And remember that it is rotating movement away from the midline, rotating movement away from the midline, away from the midline. So you can see that medially, if you are trying to rotate the leg, it will go towards the midline of the body. It is the midline of the body, and this medial rotation is sometimes called as internal rotation as well. Apart from that, the lateral rotation actually will shift your leg away from the midline. It will shift your leg away from the midline, and this lateral rotation is basically the lateral rotation of the hip also. Okay, and that is away from the midline and sometimes called as the external rotation as well. So this is about the medial and the lateral rotation. The medial and the lateral rotation. Now guys, coming on to the next one, that is the pronation and the supination. The pronation and the supination. And guys, try to remember the fact, pronation, just by the name you have to remember P for palm, and palm basically means the anterior surface of the hand. Anterior surface of the hand. So remember the palmar surface, guys, the palmar surface, it is like above, like this. The palmar surface is above. It is called as the supination movement. Okay. Apart from that, sorry, I just wrote it. Yeah. Okay. Okay. I did a mistake. I was watching the comment of someone. Yeah. Okay. Coming on to the next, that is the pronation and supination, guys. The very first one, that is the supination part. The very first one, that is the supination part. See, in the supination part, basically the palmar surface is upside. Okay, it is towards the up. Okay, it's up. And coming on to the pronation, guys, pronation is basically the palmar surface is towards down. Okay, the palmar surface is downwards. The palmar surface is downwards, and you can remember it by the help of a mnemonic that you already know that pants are basically the structures which we are wearing below. Okay, so basically the palmar surface basically will behave like pants and will be on the inferior aspect. Okay, on the below aspect, guys. Okay, and the upside one, it is the palm surface. Okay, upside one, it is the palmar surface. Okay, so that is about the pronation and supination. You can also try it over here. The palmar one, basically the supination, the palmar surface will be like above, and the pronation, basically the pants are down, the palmar surface will be down. So that is about pronation and supination. Yeah. Coming on to the next, that is the dorsiflexion and the plantar flexion, guys. So firstly, basically you should know that these both are the ankle joint movements. These both are the ankle joint movements. These both are the ankle joint movements. And remember, the above part of the leg, it is basically called as the dorsum. It is called as the dorsum, and this dorsum is basically the superficial surface of the foot. It is basically the superficial surface of the foot. You can see over here. Okay. So what is dorsiflexion? Dorsiflexion simply means when you are lifting this particular front of the foot. Okay. So write down that dorsiflexion. Basically it means the upward flexion of the foot. Okay. Upward flexion of the foot. Okay. Or simply I can say that lifting of the front of the foot so that the top of the foot moves towards the anterior leg. Moves towards the anterior leg. You can see that this is the leg part. Okay, and this is the foot. So it is a movement in such a way that the foot is coming closer to the leg. So it is the dorsiflexion. Okay, it is the dorsiflexion. Okay, and one more thing you can notice that it is reducing the angle between the leg and the dorsum of the foot. It is reducing the angle between the dorsum of the foot and the leg. You can very well appreciate in the given image. You are just trying to lift this particular foot up so that the angle between the foot and the leg is getting reduced. Okay, the angle was like this. Ultimately, it is getting reduced. Apart from that, guys, plantar flexion. Basically, the plantar is basically the downside, the plantar surface. You can see. Okay, that is also called as the sole. Okay, the plantar surface, that is also called as the sole. And remember that it reduces the angle. It reduces the angle between the back of the leg and sole. So it is trying to reducing the angle between the back of the leg and the sole. So yeah, that is about dorsiflexion and plantar flexion. I hope everyone understood this. I hope everyone understood this. Just give me a thumbs up that all of you are participating right now. All of you are writing the notes along with me. Yeah, just give me a thumbs up, guys, that everyone is participating. And yeah. So ultimately it is, yes, Prakshit is there from starting. Yeah, guys, I just need your Pratham, Naresh. Yeah, very good. Arsil, Laris, very good, guys. I hope you all are writing the notes and just try to see. It is reducing the angle between the back of the foot, okay, and the leg and the sole, okay. पहले इतना था और फिर इतना हो गया. So that is about the dorsiflexion and the plantar flexion, guys. That is about the dorsiflexion and the plantar flexion. Hariom, Anshay, Pavan, Kapil, Nishikant, very good, guys. I mean, I'm quite impressed that you guys are actually over here and studying. Sangha, very good, very good. Like, okay. Coming on to inversion and eversion. Basically, inversion simply means movement of sole of foot. You can see the sole of the foot over here, the sole of the foot towards the midline, okay, the sole of the foot medially, yeah, the sole of the foot medially, okay, or inwards, and eversion is just opposite. And remember, it is the movement of sole of the foot outwards, movement of the sole of the foot outwards. You can see the sole is going away in the lateral position, okay, so it is the lateral one, okay, it is outwards, lateral. The sole of the foot is going away from the midline, that's why it is lateral, outwards. And inversion, basically movement of the sole of the foot towards the midline. Apart from that, yeah, two more movements, that is protraction and retraction, guys. Protraction simply means that protraction, basically your shoulder, okay, moving of shoulder in the forward direction, okay. So protraction simply means moving in forward direction, and retraction basically means moving in backward direction, Apart from that, guys, remember that if you just want to understand this with the help of an example, protraction basically means moving of the shoulder forward, okay, moving of shoulder forward, and retraction basically means moving of the shoulder backwards, The last anatomical movement that I wanted to discuss with you, it is the opposition and reposition. Opposition simply means that movement of thumb and little finger towards each other, and reposition means returning to the same anatomical position, So Whenever the thumb and the little finger will come closer, it is called as opposition. And whenever they go back in their normal state, it is called as reposition. Opposition, coming closer of the thumb and the little finger and going back to the normal anatomical position, it is termed as reposition, guys. It is termed as reposition. So yes, today we have discussed the definition of anatomy, the summary of today's class, guys. We have discussed the definition of anatomy, the different branches of anatomy, different branches of anatomy. Different branches of anatomy. Apart from that, guys, we learned about the classification. Regional and systemic. Apart from that, we learned about the anatomical terms, anatomical planes, and the anatomical movement, guys. Anatomical movements. I hope all the topics that we discussed today are clear to everyone, and this is my contact number, guys. If you have any particular doubt in any of this particular thing, you can just leave a comment in the comment section. Also, I will try to reply, or you can simply text me on WhatsApp. I will try to answer your queries. I will be I would be happier to answer all your queries. Okay. So these are the topics that we discussed today, and I hope you all enjoyed the lecture today, guys. I hope all enjoyed the lecture. Really, sir, बहुत ज़्यादा अच्छा लगा. Very good. I'm so it was like a bit delayed today. So after all getting you can simply text on my WhatsApp number if you are further interested for the classes, or you can subscribe the channel. You will get further notification from the channel itself. Sir, next कब होगा? Next I'll see. I'll wait for the responses, guys. From you people. I hope you all enjoyed the lecture, guys. I hope you all enjoyed the lecture, and that's all for today. I have discussed in spite of all the issues, we actually did the basics of anatomy. Yeah. Next schedule that will be decided by the DPGI team, and ultimately I'll just get back to them. And of course, yeah, you can text on this particular number, subscribe the channel, share this video. And you want me to keep this video, or shall I delete it from the YouTube? It's up to you guys. If you want, I'll keep the video, otherwise I'll delete it. Okay, enjoyed. Very good. I've tried my best. Complete anatomy padenge yaar. If I'll get a good response, I'll definitely do it. Yeah. Okay. So Hari Om, that's the deformity, guys. You will learn about all the deformities in orthopedics. Okay, you will study orthopedics in 4th year. First, we'll just try to focus on the general anatomy part as of now. Yeah, I just wrote the number over here. You can see. Subscribe the channel. You'll get the notification early as well. Okay. Just watch the video. Yeah, let it be. Okay, guys. I hope you all are writing the notes. That's comparatively good. Okay, guys. So goodbye, everyone, and I hope all the best to everyone. Okay, guys. Yeah. Bye.